Well, let's get rolling. Excited to have you, Brian, today for this. We've known Brian for pretty much since we started Prompt. I think you were one of the first people we talked to, and it's exciting to be around people that are forward thinking, and I think you certainly fit that bill. I know you have a lot to cover today, so without further ado, you want to take the reins?
All right. Well, thank you so much, Mike. And I really love what you're doing for the profession and doing an educational series like this. You know, you're not just in the business of doing your business, you're in the business of assisting other PTs in private practice, thrive in their business, right? So that aligns with me. We hit it off right when we first met because I could pick up that was the main reason why you guys went after this. Like, you didn't have to do this. You could have done many other things, but physical therapy actually needed an innovative and advanced leverage technology within the EMR space, something that really handled more than just documentation, scheduling, and billing. And I think, for those of you who are tuning in, we were having an earlier conversation off the air, and Mike was saying, last year was a big year with 23 updates. I'm like, that's amazing. I mean, that's like truly amazing, like truly being true to your word about we are going to do everything we can to try and be the most relevant EMR system in this space for physical therapists and be the most advanced as much as possible. And for those of you who may or may not know, that stuff is not cheap. I mean, going back and doing revisions and software development and integrating that into applications of technology, that's true commitment there. So I'm grateful to be here on your webinar, and I'm grateful for what you and your brother and your company is doing for our fellow PTs and PT owners. You're always one of our top EMR companies that we always put in front of people for them to seriously consider going with. And to that end, as you were saying again off the air, maybe it was Tim that was saying, EMRs are a percent of your gross income per year. It's not a utility bill. It's pay to play, right? You're going to pay to play the best game you can on this field of physical therapy private practice. And so you need the best tools, you need the best equipment, if you will, in order to play the best game. So I think Prompt does hold true to that. Mike, before I get into the details of this, how to overcome the income squeeze, part one, what could you share with the audience about, because look, I'm coming at it from a business model perspective. You're coming at it from, I've got to equip people with the appropriate tools, knowledge, and technology to actually advance their execution of what they're doing administratively within their practice. What came across your desk, your radar, that you felt needed to go in last year, that you felt so passionately about, because you have got to be seeing the same thing I'm seeing about this income squeeze as we're going to dissect it in the next hour. But just to start us off, you see the same thing. You put something in.
Yeah. So, I mean, the way we look at technology is how do we save time? How do we increase your revenue through billing better, having better data, all of that aspects. Specifically, like, it's impossible to get a therapy note to zero. There's still going to be some input there, but there's so many admin tasks and tasks on billing that we can get rid of a lot of the noise and place people on higher value tasks. So we just try to identify steps that take 20 items of input. How do we get those inputs down to ideally zero, but 1 to 2 processes? I mean, expenses on the salary side, for an average clinic is 50 to 60% from what we've seen. So how do we get that 50 to 60% on the highest value tasks?
Absolutely. And I think you hit the nail on the head right there. Why do we want to hone in? Look, time is money, right? So that was the first thing you said. Anything we can do to create greater levels of efficiency, we're going to reduce time, we're going to save money. Very good. Well said. Use technology. Let's leverage that. But let's dig a little deeper underneath that layer. If you look under that layer, well, what's the impact of time? Well, the impact of time is on payroll, your largest expense, your largest operating expense in your business. So if your technology, if your advanced EMR processes can reduce my payroll, below the acceptable thresholded window of 50 to 60% of GI annually or monthly, however you want to look at it, you will effectively be pushing all of that revenue to the bottom line, right? To the bottom line. Quick little story. I took my business back after I had sold it, and I walked in after, being gone 3 years, and I walked in and the payroll was 78% of the GI. The payroll was 78% of the GI. So needless to say, my quick actions were to reduce staff, increase revenue, and streamline systems of operation. So everything had to change. You can't survive, you can't thrive when your payroll is at 78% of GI. When I was done, our payroll was around 53% of GI. Now, we were a big operation, 8,000 square foot office, 3,500 square foot office. Today, in today's world, I'm trying to get every single person who's listening, who's a Med client, who works with us, to push that payroll well below 50% of GI and move some of that operating expense to the bill category, to the OE operating expense category, whereby you're not dealing with turnover and benefits and FICA and all of these ancillary add-ons to get the same outcome. So I'm hoping you guys will cognate and see where I'm going with that, because at the end of the day, the only way you're going to overcome this income squeeze is by literally getting rid of the box, not thinking outside the box, getting rid of the box and building a brand new box. And so let's see if we can make some sense out of that. I'm not the only one who's seeing it too. I jotted down a couple quotes. I'm on everybody's emails lists and I'm subscribed to as many things as I can. Chad Madden just put out just this week, there is a need for major changes within the business model of physical therapy. That was his quote. Heidi from WebPT put out about 3 weeks ago. She says, we are at a breaking point in our operating basis in physical therapy. Those are two quotes from two other leaders in our industry, right? So I think we're all seeing the same thing. And I just went away and did a lot of study, research, and development. And I think I have an answer that is definitely worth looking at. At least I hope you're willing to spend some time and look at it. So what is the income squeeze? Let's first understand, before we talk solutions, let's talk problem, right? Let's fully wrap our arms around this problem, because we can scratch the surface. We can talk about it from the right flank, left flank, but we got to hit this thing head on, right? So what is the income squeeze? What do I mean by that? Today in private practice, if you're a physical therapist in private practice, you are hitting certain challenges pretty routinely. And these challenges are, to a greater or lesser extent, pretty consistent across the board with just about everybody. So the very first challenge that we're dealing with right now that many of us have to confront is reduced reimbursements. I don't find many owners are like, yeah, things are going pretty good in my part of the country. I'm up 8% over 3 years ago on my average collections per visit, my average reimbursement per visit, and my average fee schedule per visit. Yeah, that's not what I'm seeing. You can increase your collections, but trust me, it's not because Blue Cross wants to pay you more money. Now, are there little cost of living adjustments? Of course there are. When do they come? Every single year? Of course they don't. They may come every 10 years, every 5 to 7 years. And even when they come, they're nowhere close to keeping up at the rate of inflation, especially now. We are in a unique situation today. We are in a state of hyperinflation. A year ago, I had, let me just be more exact, more precise. Over the last 3 years, I have helped open up over 28 startups. I'm probably more like around 32, 34, but I don't want to overstate it. So I'm just going to say safely, I've done at least 28 startups in the last 3 years. My clients who reach in and want to start up a private practice, we've never had a startup fail. So we've got a 27-step process, 21-step process if you're more of a hybrid model, 27-step if you're a more traditional model. So anyways, we custom build it, we custom design it based on where you are in the country, how you want to do it. But we follow this training, this development, this coaching methodology because it's worked. We've been doing startups since 2006, and we've never had anybody not make it to their 30-year anniversary profitable. It's never happened. So we're going to keep doing it as long as that dog's hunting. Why stop, right? My point here is, I don't I don't see that there is an ability to outrun your expenses, because the income coming in for the services we're rendering is so low. And when you do these startups, just to kind of get it out of the gate, if you will, a startup will typically go get an SBA loan. And I just want to make this point about this in hyperinflation. This hyperinflation is adding to your expenses, which is compounding the fact that your income reimbursement's going down, your expenses are going up. 2 years ago, an SBA loan was about 8.5%. Depending on where you are, it could go up or down 1 point. I just got off the phone this morning with a owner who's starting up a big practice in Montana, and she told me she was just quoted 14.25%. 14.25%. Now, you're not even open, and you're confronted with an interest rate on your borrowed capital that's nearly double what it was 2 years ago. So reality is setting in, right? Increased business expenses, that's number 2. So if Blue Cross is paying us less, Medicare just, reduce what they're paying for PTAs, there's a 3% cut, you got these added business expenses, starting right off with your capitalization with your SBA loan. Pay and benefit demands. I was at PPS. I was with Mike and his team. We had a great time. We spoke to hundreds of owners throughout the time we were there. And when I was delivering our breakout session, I literally had people in the room saying, I can't hire a front desk coordinator for under $25 an hour. The cost of living, the cost of buying groceries and making rent payments, and stuff, that people just, this is a front desk position. This is an entry level position that could be developed into a true profession with some level of experience, expertise, knowledge, training, and on proper onboarding and compliance. Absolutely, patient care front desk coordinator, patient care receptionist, whatever you want to call, can truly be a profession of great value, but it takes time, it takes years, it takes training, it takes commitment. Not this entry level, well, I'll come, I'll sit down, I'll consider taking a job, but it's going to be $25 an hour. In other places of the country, it's $15 an hour. So you can see this is getting pretty out of proportion at this point in time. But pay and benefits is really important, and right now, according to data, health insurance for a family of 4 is currently averaging about 10% of one's annual income. The median annual income of a family of 4, 10% of that income is going to just supplying your health insurance to your family. So these benefits are skyrocketing as well. Expectations for academia. Overall, I loved going to college. I loved my professors. I learned a lot, but I'll be honest with you. The reality in real life, after being out and being a treating therapist for 3 years, didn't necessarily match up with what I was told when I was in PT school, my senior year coming out. What I was told by people who I knew, liked, and trusted at the time in academia wasn't really rooted in reality of the real job. And so I kind of came out with some skewed opinions about how things should be and what's ethical or unethical. And I think I see a lot of that today. I see a lot of new grads coming out and being like, what do you mean I have to see more than 10 patients a day? Well, how do you do that? I can't cross over a patient with another patient and still, provide one-on-one quality care. And I'm like, really? You have a responsibility as an entry-level new grad in your first 3 years to learn how to do that, to learn how to give a proficient level of care, an expert level of care where you're mirroring together your knowledge with your expertise, your experience, and you're actually becoming an expert clinician so that you're practicing in the top 10% of your license. Medicare does not restrict you from going back and forth, adding times. There's 4 different tools you can use that keeps it above board. I'm not interested in the gray area. This is not about schedule management, so we won't go down that road. But the answers are there, is my point. But a lot of people are being told in school certain things that you can or can't do. And it's for the most part, I'm finding it's just false data. So I'm imploring you, if you're in that 0 to 3 years out, really keep an open mind, keep your eyes open. I have not found in my 30 years of carrying a PT degree, PT license, and working in this space, I have not found by any stretch that PT owners are looking to take advantage of you. They're looking to run the risk of you wearing orange and black and losing your license. They're not. They're really trying to do the absolute best they can for everybody involved, more so today than ever before. Employee retention, and that leads me right to employee retention. The average turnover cost of a therapist revolving through a practice is somewhere in the area of $20,000 to $23,000. So trust me, if you're a PT private practice owner, you're going to do all that you can to have that ideal company culture, that ideal staff experience and retention, because you typically don't have a hiring problem. You have a retention problem. If you're better at infusing what's most needed and wanted with your staff, you will be looking for fewer people over time. So there's never enough, I think on average, there's about 20,000 chairs that go empty every single day needing a physical therapist, and it's unchaired, unstaffed. There's reasons for that, but it's not necessarily everyone's problem. The best practices don't have as much of a problem with that because they're a draw, and they're a draw for the right reasons. So the solution here moving forward in this income squeeze is you have to evolve. You absolutely have to start considering that we have been practicing the same way since 1950. So here's a QR code. Please take this screen down, screenshot it, or whatever you need. You can scan that and pull up the article where you have all of this data. The impact of losing your staff, I told you, it's not a recruiting issue, it's a retention problem. 40.8% are facing higher turnover rates now than they were 2 years ago. This is off of the APTA article. Most employees who leave practices voluntarily, the top 3 reasons is relocation, pay, and work-life balance. Now, I will say a lot of people are relocating out of busy, congested city living, if you will, and they're looking for more space. They're looking for quieter, slower, a little less randomity, if you will. Not everybody. Hey, it's still fun to live in New York. Everything's open all night, right? California cities are beautiful. Every time I land in California, I go to Orange County or San Diego or even San Francisco. It's just beautiful, right? But living there is not like visiting there. And being in a city today is a different lifestyle than what it was, let's say 10 years ago. I don't watch the news anymore. I'm trying to unplug from all that. I just watch financial business stuff. But I am aware that style is changing and people are actually moving. So this work-life balance and increased pay with a relocation in mind kind of all goes together. I think it all makes sense. The impact to you as a practice owner by not having some sort of staff retention program in, which I highly recommend a pay for performance model. If you want to learn more, just reach out to us. I'd be happy to sit and talk to you for an hour and share with you how that actually works. No pressure at all. I just want you to have all the tools you can get. The impact of losing staff is like what I said, it'll typically take you 3 months to get somebody back in that spot. 38% of clinics say that it takes them less than a month to fill a position. Well, that's only 38%. So the majority of people, it's taking a much longer time. And think of the lost revenue, the lost income you're suffering with each and every month that goes by that you don't have a spot filled. Now, this is the State of Rehab article that WebPT put out, which is excellent data driven. You should definitely get on their email list and grab that data, study it. I went through all the pages. I actually did a podcast on it with Heidi. You can go look at our list of podcasts and listen to Heidi and I kind of summarize the whole report, because I think it's like 60 pages long or 40 something pages long. I don't remember off the top of my head, but it's pretty lengthy. So definitely look at that. The top 3 rules which therapy organizations saw the most turnover was physical therapists, clerical staff, and PT assistants. Okay, so let's just say this. DPTs and PT assistants, that's obvious. Okay, biggest turnover there. Because if I remember from the report, there's something like in the area of 11% of people actually leaving the profession. They're actually leaving the profession for some sort of administrative or managerial position, not so much clinical. So that's not helping. So what do we mean by clerical staff? For the most part, we're talking front desk, not a whole lot on that billing side or marketing side or whatnot. We're talking your front desk, your insurance verification officer, your patient care registration officer, things like that. So we have to have a solution to that, because that destabilizes everything. Your front desk is the communication hub of your entire practice. So without that being stabilized, everything else is a trickle-down effect. And I think you'll agree that if you've ever had to do the front desk and register people and sign them up, it's tough. It's tough, along with your patient care responsibilities too. So I always say, regardless of who comes on my lines and whether they want our billing services, because we provide billing services and prompts, like one of our preferred EMR softwares, of course, whether they want our credentialing services or our virtual front desk services, our virtual insurance verification officer, or whatever services they want, you need to be operating from a position of control. What you can control is going to actually drive the business closer and closer to your ideal scene. Think about this. If you're going to go on a trip, as much as I like Mike, if he and I are getting in the car in Jersey and we're going to Disney, chances are I'm going to be fighting with him for that steering wheel, because I feel a lot better when I'm driving. I feel a lot better when I'm driving. I'm making decisions. I'm deciding when to get gas. I'm deciding we're eating healthy. We're not doing fast food, Mike. That ain't happening. I feel much better when I have the steering wheel control, because I can make my future. I can make things happen. When I'm a passenger, when you're more the effect of what's going on around you, then you feel the effect. You feel small. You feel minimized. You feel reduced. You feel like you're more reactionary. What I loved about starting this webinar with you guys today was talking to Tim and Mike and sharing with me 23 upgrades in a year. That's in control. That's being at cause. You can either be one of two things at any moment in your life. You're either at cause, making things happen, being more in control, more free, more liberty, or you're the effect. You're the effect of things around you and people, and you're going to justify. You're going to come up with excuses. You're going to say things in broad generalities. You're going to point the finger at things as to why things aren't going the way they're. Look, if things aren't going the way you want them to go in your life, there's only one reason for that, and that's you. That is literally you. Get up, start tomorrow, expecting to do well. It's what I say in my podcast every week, and do something about it. Make the appropriate changes. And it's not going to be staying in the same box business model, which is the fee-for-service business model. The fee-for-service business model that was developed in 1950 is still the way people are practicing today. If you're going to stay in this fee-for-service practice model, that means the only weapons you have is more patients and more charges. That's it. That's all you've got. Those are the only two arrows you're going to fight with. You need to get rid of that quiver and get a better arsenal to fight the fight with, because healthcare has changed dramatically. Here's what you want to try and control. You have to think about ways and means to control your payroll costs. Payroll costs, as I have it written there, is not just payroll. We're talking FICA, workers' comp, benefits, PTO, holiday pay, all of that stuff, Aflac, whatever, short-term disability, long-term disability, all of that falls into your payroll costs, right? Social Security, Medicare, blah, 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 just inflates. For most people who are a top producer in the physical therapy private practice arena, your payroll is somewhere between 50 to 60% of your yearly GI, your yearly gross income. Basically 50 to 60 cents on the dollar that comes in is going out in payroll. What if I could show you how to get that down into the 30s? That would be a game changer. Now, all those costs aren't going to go away. They're just going to be reallocated into a different bucket that's going to have a smaller financial impact on your practice. And I think this is why Mike wanted me on this webinar. He wanted me to try and not just diagnose the problem, but try and give some insight as to what you can do about it. How powerful you can be if you have this knowledge and you have the steering wheel. You can make the changes in your life so you can live a better life for your family, your practice, your staff, and your patients. Okay. And that's what it's all about, right? Pay for performance model. Notice that's not a shared risk model. I'm not a fan of shared risk model. I don't think employees want to come in and share anybody else's risk. I think they've got enough going on in their life. I want to align as many PT owners, such as yourself, with your staff, just like orthopedic surgeons are paid today, just like neurosurgeons are paid today, just like cardiologists. They've been on that model for 20 years because big hospital, big financial, big healthcare institutions long recognize we can't just pay you a salary and benefits and it doesn't matter what you did today. There's no accountability for being busy or not busy. I mean, unless you just want to be a government employee and just get paid for breathing and just come in. I'm joking, right? For all of you who work for the government, I'm joking, but you got to trust. I mean, I have a little bit of credence here, right? When you work for these bigger bureaucracies, nobody's trying to outrun anybody else. Trust me. My father-in-law worked for the government for 35 years. I saw it with my own two eyes. They're exchanging time for money. You can't afford to exchange time for money. I'm going to get a lot of hate mail on that government one, but yeah, I still stand behind it. Outsource your admin functions. Part of that outsourcing of your admin functions is get a darn good EMR system. I mean, obviously you guys are listening because you're prompt clients or you're related or you're closely related or you're soon to be. Well, you're not just getting something that's going to handle your schedule, your documentation and your billing. I mean, that's just not what Mike and Tim and the whole team at Prompt is about. They're about developing an administrative, highly technologically advanced accounting practice management software system, a full system that's going to be infused into every one of the 5 divisions in your practice. And you do have 5 divisions going on in your practice. And if your EMR system can touch each of those 5 divisions for your benefit, you should be all about that, right? So outsourcing some admin functions, I'm going to show you what you can do on the human side of that outsourcing. Obviously, you need good technology. And that's number 4. I kind of already covered that by just sharing with you what I just shared. So you're going to need personnel to come off the payroll, and you're going to need functions to be pushed into optimized advanced technology within your practice. So ditch the current model is my message right here. And let's not think about how we can get outside the box, do a couple little things, some trimmings and Christmas lights and kind of make it a little prettier. It's not going to help you. You can't, because the only thing you're going to do is run on the treadmill faster and say more patients, more patients. That's my answer. Or how can I get my therapist to do 4 units a visit, 5 units a visit? And if you've been listening to me, maybe you have, maybe you haven't. I've been saying for a good long time, PTs don't bill. PTs have nothing to do with billing. Think about PT school. I spent 5 years in PT school. I never had a billing course. There was no billing 101 because we don't bill. We're not billers. We see our patient, we write a note, and then we reflect what's written in the note into the digital codes, the CPT codes, so that the digital system can read what we did for compliance purposes. That's it. Whether they're going to pay per code, they're going to pay per visit, they're going to pay per capitation, they're going to pay a flat rate payer. It is what that is. That's their end. That's the other end. That's not what I went to school for. I went to school to be the best therapist I could be, to see, number one, as many people in my community as I possibly can in a day, a week, a month, a year, because I'm trying to have the biggest impact on the most number of people. I'm blessed and I'm grateful every single time I have an evaluation, every single time I have a patient waiting for me. I had 12 clinics within 2 miles of my office, 12 other places they could have gone within 2 miles of my clinic, and they chose to be here with me. So the least I could do is have that mutual level of respect and be like, I am so grateful you're here. I'm going to see you in the most efficient, productive way possible to get you to achieve your outcomes and have long-term optimum health even after physical therapy is over. So number one, see as many people as I humanly can while maintaining good, high-quality care, according to me. And number 2, deliver an abundance of physical therapy with each and every session. With each and every session, I want to have 4 units, 5 units. I want to give as much care as I possibly can that is fair and ethical and accountable and responsible. So I need to have the ideal schedule. I need to have the ideal support staff. I need to have the ideal technology. all at my fingertips so that I can see as many people as possible and give as much care per person as possible. That is the only two reasons why you went to PT school. Two, I should say two, not this. The only two reasons why you went to PT school is to help as many people as you can and give as much help as you can with each and every engagement. Everything else, oh, I went to PT school to help people. No, that's being human. Everybody on planet Earth should be having some attention on wanting to help your fellow man and woman to the right and left of you, right? But to be a healthcare professional like a physical therapist, it's all about optimizing people's health, and the more people, the better. So spend time in outpatient practice from this day forward, doing what you do best, and let's outsource the rest. I claim there are 4 areas within every practice that you should have no personnel on payroll for anymore. Virtual front desk, outsourcing your billing, outsourcing your marketing, and the 4th one would be outsourcing your credentialing. Now, I put in remote therapeutic monitoring because this just increases your viability by having a greater depth and reach within your community. So this had to go in there. Credentialing, you can kind of throw in with the outsourced billing if you'd like. But in our business model here at Meg Business Management, I have a specific department that will credential all of your therapists with any insurance carrier you want. United Healthcare, Aetna, Medicare, whomever. As long as the panel's open, we're going to get you in. And if it's not, we're going to give you suggestions how to break in and get into it. Virtual front desk, we have 3 tiers of that virtual front desk. We have a full service. We'll handle everything. We pull the whole rack system in your waiting room. People go home. We can sign them in. We can take eval calls. We can take money over the counter collected. We can run credit cards. We can give them their new patient paperwork. They're a live human being. I don't believe in a kiosk. I believe someone's got to greet everybody. It's got to be warm and friendly and natural. And you're only paying for what you use, but they do everything. Okay. Insurance verification, patient registration, cancellations, fees, collections, sign them in, sign them out. Second is, let's say you have a very good person at the front, but they're overworked, they're overloaded. Well, we can be a call center to you. That person can do what they do. All the other calls come to us. We sign people in, we put them in, we schedule them, we handle your evals. You just have somebody manning the phones who knows physical therapy. We're not talking Regis or something that they don't even know. Nobody with our group is outside the US. That I don't believe in that either, because you got to report that to Medicare if you're doing that. So you got a live human being from America who's working with your patients live in real time. And then the third is insurance verification, initial auths, insurance verifications, re-auths, and so on and so forth. Big, big difference. I don't think I could ever keep up with the social media marketing and the digital media and Google Analytics and all that. So I work with a team that we farm that team to all of our people. Maybe it's you as well, or you're looking for that, but this team specifically handles that so that you can have higher views and higher reach for your services from people within your community. So I think you need, and again, you're only paying for what you use. I mean, otherwise you're going to pay $45,000 for some marketing person to be on your payroll who maybe they're doing it, maybe they're not. How do you know? I mean, are they in Burger King, or are they out there actually talking to people in the community? You don't know. The front desk is the heartbeat of your practice. This is our newest area, and this is the one that's going to have the greatest impact on your bottom line and the overall patient satisfaction, because you're not going to have to deal with maternity leaves and sick and bad hair days and drama. And I mean, look, I'm just saying it like it is. You know what's happened over the last 3 or 4 years, and you know what you're dealing with at your front desk, the lack of consistency, the lack of follow through. So in the event that you're open to the idea of having a full screen with a full system there who's doing all the work for you, what you're going to get is you're going to get a real live person who's going to be the face and voice of your practice. They're going to help the patient be compliant with all their appointments and all their scheduled coming and goings, right? And what they have to do, their home program and the paperwork they need and all that. It ensures that you're going to get paid for the services that you've provided. If your front desk is inconsistent, you're going to have denials and rejections, and we superimposed their Medicare numbers, so it got kicked back and we have to resubmit. All of that time adds more money to your cost. They are the communication hub between the patients, your public, and your professional staff. Look, I honestly think the future of physical therapy is going to be just licensed providers inside that office. I mean, maybe PTs, PTAs, and a tech, but nothing beyond that. I mean, if my wife goes and gets her hair done at the salon, there's nobody checking her in, sweeping the floor, washing the mirrors, just a beautician. She's doing everything these days because you can't afford it. You can't afford that additional payroll. Same thing's going to happen here in PT is my suspicion. I believe within the next 5 to 7 years, 50% of all practices are going to be set up in this new business model, which is called the professional patient care model, not the fee-for-service business model that everybody's on today. But I think you're going to see this mass migration. At least we're inundated with people migrating to a professional patient care model. In order for that to be effective and actually work, you need to have your 5 divisions. You have 5 divisions. I don't care if you're a lemonade stand with 3 people, you have 5 business divisions. Mike has 5 divisions in his company. Whether he's structured, organized, and systematically designed that way or not, it's happening. It's just how he wants to manage that chaos, how he wants to manage the communication and flow through his group, which I'm sure is going really well because they're doing wonderful. 5 divisions. Every company has an executive division. That's the visionary division. That's the one that's going to push forward thoughts, ideas, strategies, plans, policies, legal, accounting, liability, all in Division 5. Division 5 oversees everything else. You don't have Division 5 if you don't have the other 4 pillars, which is why Division 5 is horizontal at the top. Division 1, administrative division. Before you even get started in business, you start here. What's our pro forma? What do we need? What's our cost? What's our income analysis? Who do we hire? What's their main duties and responsibilities, and who's talking to the patient? In this Division 1 is where you're going to find office administration, office managers, front desk coordinator, and compliance officer. We're going to pull out that front desk coordinator. We're going to talk mostly about that person as we move on. Division 2 is your marketing division, though. You have internal marketing and external marketing. You have branding and marketing. You have hunting and farming. Totally 2 different things. As you can see with all my divisions, I not only say what the topic of the division is, or where all the work is in that division, I also show you who are the positions, what are the posts within that division, what are their duties, what are the things that they have to do, what is the source work that they have to be dedicated and devoted to. As a result of that, my biggest point of interest is products. If those people come to work every day and do those duties, what should I see rolling off the conveyor belt, rolling off because that's what I'm paying them for. I mean, honestly, I don't care if somebody comes to work and rubs a crystal on their head all day. That is not what I'm paying you for. I'm not paying you for what you do. I'm not paying you for your time. I'm not exchanging time for money. Not interested. I'm exchanging compensation for products. How do I know I'm getting the products? Because I've defined the statistics that measure the products. Only 2 ways, 2, there again with the 2, right? That's 4. There's only 2 ways to manage people in any business entity or any business forum, and that is by personality. Oh, I like her. Oh, I like him. He buys me Krispy Kremes. She laughs at my jokes. Raise, right? You get a raise, time off. Or managed by statistics. Managing by statistics in a pay-for-performance arrangement ensures that you're directing your juniors, you're directing your staff, your collaborative team members to focus on their product, to focus on their goal attainment. And for that, they have the ability to have greater and greater opportunities within your organization, both compensation and freedom-wise. Because I want everybody to have work-life balance. I want work-life balance too. But the first word in that statement is work. I can't have life balance without the work. And unfortunately, over the last 5 years, we've seen our fair share of people who are interested in getting paid for doing as little as possible. So we got to get on that. Division 3 is finance, money in, money out, bookkeeping, billing. This is where your EMR is going to go. Your staff's going to go in there. I have that all broken out. And Division 4 is your production. Anybody who's generating revenue as a result of their actions. This is your clinical staff. This is your licensed professionals. So let's just pull out that front desk duty for a second, because like I said, what we're really talking about here is handling the income squeeze. Reimbursement for services going down, cost of doing business is going up. We can't very well go and beat down the front door of Blue Cross Blue Shield or United Healthcare and squeeze out more money out of them. I mean, you can. I see people submit and try, and it might be $1 or $2 or $3, maybe if you're lucky. So by all means, I'm not poo-pooing that idea. I think you should go after trying to increase reimbursement. I have several training videos on how to do that. I have several lectures and articles of what to say and how to say it, and to give you the best advantage, the best opportunity to try and get them to give you some cost of living adjustment. So by all means, I am in that camp. But I do know reality sets in, it's limited. It's limited in what they're willing to do. It's criminal in my mind, but it's very limited, especially Medicare. I just don't get it. I mean, these people paid into the system their whole working life. And then at the time that they want it, now, there was a cap, and now there's like reduction and reimbursement. We've got billions of dollars to send overseas to other people, but yet we don't have the money to keep Medicare solvent. I mean, don't get me started. I can get off on these things, but it's insanity. If you haven't heard my podcast on the healthcare history of the healthcare system, please look that one up. That's a pretty good one. Front desk duties, you guys know what they are. Money over the counter collected. All money due at the time of service must be collected. Being a problem solver, I want your front desk person to think about problems, think about things that come up. How can I work around that? Think on their feet. Be proficient in managing the schedule. We call this cluster booking. You come in Monday morning, you look at the openings you have in your schedule, you pull the people that are coming in as evals from Wednesday to Friday, pull them into the Monday to Wednesday open slots. That opens up more slots at the end of the week, more slots for revisits, more slots for cancellation visits, more slots for evals. Better for the patient, better for the practice, better for your front desk. Every Monday morning, that's a cluster book. We do all this kind of training so that you can get the most out of that schedule. Patient registration. Problem is, a lot of people have a very busy front desk, people coming, going, signing in, signing out, paying payments, whatever, answering phones, doing insurance verification. They lose their train of thought. They put something in the system. It's incomplete. It's not followed through with. They thought they were going to get to it later. They didn't get to it later. We got a problem. Now we have inaccuracies in our patient registration. Not good. Now you're not getting paid. You're doing work twice. There I go. I got the numbers right. You're working twice for the same outcome. Every single time you work twice for the same outcome, you are losing money. You're at a 50% loss. Patient chart accuracy. That system has to be extremely accurate in there. Otherwise, the back end can't move forward. I'll tell you, if I'm looking at an EMR system and it doesn't front load in the schedule, the outstanding monies due, whether it be copay, deductible, coinsurance, or whatever, I'm not interested in that EMR system. I want a system that allows me to collect from the patient in real time and real obligations. Every time an EOB comes in, it gets posted against the account, the balance due goes to the patient. I want to collect that at the front desk. Your rate of collections drops dramatically when you start using the US Postal Service. And why would you want to do that? I mean, look, I have a billing company with well over 160 clients all across the country. So we do this on a massive scale. We got like 85 employees that just are specialists in billing. And I can tell you this, if they're doing their job and they have to deal with inaccuracies, it makes them have to do the same work twice, and it just reduces your collections for sure. Timeliness is everything. All right, so how do we measure the success at that front desk? Over the counter collected needs to be 100%. Whatever's due, we need to handle that. We need to collect that. Percentage of kept. I want the percentage of kept up. I want 85% is a cutoff. It's pants on fire if you're not getting at least that. Our goal is 92%. I come in, there's 100 people on the schedule. I expect 92 or greater of them to be on that schedule and have been seen this week when Friday's over. Substats are what drives the main stats. So you don't really focus on the main stats, you focus on the substats because they're the ones that get you the main stats. So the number of plan of care scheduled and in full, fully executed, confirmation calls, next day appointments, if that's automated, that's great. Percent of prescribed. Many of you guys don't even know what that is. You haven't heard of that before. Percent of prescribed. Oops, that was my bad. Percent of prescribed means I prescribed 12 visits 3 times a week for 4 weeks. What percent of people actually met that prescription? And there's certain mechanisms you can do. We have all kinds of strategies on how to increase that. Very important stat. Benefits of a virtual front desk. So as I said, we pulled out that front desk person. We went into some of the details of their job duties and stats and goals. That's what we just did. But you may be sitting there going, well, Brian, how is this going to benefit me? Why is this better than me having a human being here showing up each and every day? These are the benefits. And I tell you, there's more than this. There's more than this. We would just clutter up the slide. So we just put in what we thought just about everybody would relate with and you would identify with. There's no need for you to recruit and hire staff anymore. When you sign an agreement to have a virtual front desk person staffing your front desk, that's it. No more hiring. That's on us. We have a pipeline of people. Do you know when we find somebody to come in and do this role for us, before they ever get assigned to you, they're going through 2 to 3 weeks of intensive training with us. You don't pay for that. We do all of that so that when that person gets onto your account and they're a partner in your business, they're a team member with you. I don't like to think of us as a vendor. They're literally a team member. You're going to feel like, wow, everything is covered. Like everything is exactly the way you need it to be. Better performing employees because we're shopping from a bigger pool. If you stay in the fee-for-service business model and you keep hiring employees to come into your office and work your clinic, chances are the pool in which you're hiring from is just a zip code that you're in. And how many talented people do you have there? I'm pulling people from 30 different states at the moment. At the moment, I got employees in 30 different states. So I can pick the best talent all around the country and have them work within your office through a big screen like Zoom, live and interactive. So it's pretty cool. Really does help you a lot to have the ability for us to have the ability to pull from a bigger pool. Outsourced onboarding. We'll do the onboarding, get them up and ready in their first 30 days. You don't have to worry about that. Less personnel to manage. You know, for the first time in my life, been doing this for 30 years, I'm now hearing people say, well, you know, Brian, more people, more problems. I'm like, oh, that's so sad. I live in a people profession. That's what I've been in my whole life. It's like, I don't think of people as problems, but that's what owners are telling me. More people, more problems. If I could do the same work, this is what people say. If I can do the same work or more work with less people, I'm all in. Show me how to do that. Well, this is one big, huge step forward of how you can do that. No longer worry about PTO or employees calling out sick. You know, that's a huge burden right there. Performance reviews, don't have to do those anymore. How uncomfortable is that for so many of you to sit down and they want a raise and they didn't earn a raise and you're going to say, I'm going to give you 50 cents. They want $1.50. They're going to walk if you don't pay them. And now you're the effect of your own staff. What's happening here? No more raises, save in payroll taxes. These just go, you know, this is no longer on your books. Improve front desk operations and workflow because we're doing it with clinics all over the country. We're going to bring the most successful actions to your practice that you may not have even ever thought of. You may never have thought of them. Quality assurance is implemented. We have the responsibility of overseeing our billing services, our credentialing services, our virtual front desk services, and making sure that the quality is above the bar. I'm not going to sit back and wait for you to come and bring something to our attention and say it's going good or bad or wish it was better. We're going to be bringing it to your attention on how we can make it better. You should look at this as if I have fewer people to manage, I have more time to focus on my CEO responsibilities. And your CEO responsibilities is to grow and develop your practice and increase greater levels of viability through increased net revenue. That is what an entrepreneur does. You succeed not by cutting costs as much as you do by increasing revenue. When you increase revenue and cut costs, the income squeeze is going in the opposite direction. You're going to just do way, way better with that. So that's this broken down. That doesn't even mention the fact you're not spending money on toner and cartridges and computers and printers. I mean, what's a stamp these days when you do your own in-house billing? I mean, really, it's like $6 for a stamp and you're sending these out to all these claims and statements. Ugh. Get out of that. You want to try to step away from that if you can. Virtual front desk gives you great consistency. It's going to be stable. It's going to improve your patient's experience, reduce the headaches of inconsistent people, sometimes at work, sometimes they're not at work, right? Management, no longer have to worry about that personnel, the raises, the performance reviews, the disciplinary actions, you know, the bad hair day, the drama, she didn't say hi to me and he talked short to me, right? All that kind of management kind of stuff. Efficiency, save time on recruiting. You're not going to be running ads. You're not going to be doing interviews. You're not going to be doing sign-on bonuses. You're not losing money twice because you now have to train this person for 3 weeks and tie up 2 people instead of just 1. You're going to reduce all those costs. And it's simple. It is so simple. The simplicity of a virtual front desk is it's live, it's interactive, it's there. You have total support. We handle the phones, we handle the emails, we handle the EOBs, we handle the new patient paperwork, everything to whatever depth you want. You can have little, you can have a lot, you pick and choose. This is the new tomorrow. This is the future. Your payroll costs are going to go down. You're going to pay for services without all of the, indirect expenses associated with it. That all goes away. Makes all the difference in the world. What services should the virtual front desk be performing for you? So this was my bad. A year ago, when we started our virtual front desk, I was like, okay, 4 to 6 month pilot. This is what they need to learn how to do. This is the technology we need to do it in. Because, I thought in my head, the solution to the income squeeze is for you as a practice owner to step back for a minute and imagine an environment. Like I was thinking, like if I go into private practice today, like if I was to go back into private practice today, because I sold my clinics in 2018, if I was going to go in today, I would be wanting to imagine a physical therapy private practice that is using advanced technology in the hands of highly trained professionals that meant in the highly trained professionals that did all the hiring, let me say it this way, that did all the hiring, all the training, and all the management. If I could have a physical therapy practice that had advanced technology in the hands of highly trained professionals who are covering the hiring, retention, the training, and the management of these people, and I just paid a flat bill for that service or a prorated for whatever scalable I did, sign me up. Sign me up. I am escaping all of the employee liabilities, all of the accusations, it's a crazy world out there. You know what I'm talking about. All of that goes away. All of that goes away. So this is typically what you would expect at your front desk. I mean, there's nothing on this slide that I think you would disagree with. Check it. I'm not going to read the slide. I'm not going to do it. You can see it. I've left it up here while I was chatting. I'm not one of those presenters that likes to read my slide. So check that out. POC is Plan of Cares. Reports, stats, metrics, incoming, outgoing, most importantly, great communication. Very, very good communication. Here's a nice little setup right here. So when we handle the recruiting and training, you don't have to do it. I don't know if many of you guys know this, but I had a staffing company for a long time in the state of Maryland. I had about 160 employees, and we were staffing all throughout the state in multitude different counties. So I'm very familiar with this kind of remote handling and training and development. So we're not guessing. We've got years and years of experience doing this. So I'm going to open this up to you guys. I hope you guys can write some chats and some questions in the chat, or just, I don't know how Mike and Tim want to handle that, but I'm going to move this forward so you can totally reach out to me after this webinar. I'm happy to answer any questions on Mike's behalf. I'm very grateful for him to have me here. I hope some of this information jogged you a little bit, rocked you a little bit, got you to start thinking about potentially changing up everything you've been doing. And we'll open it to questions.
Thanks, Brian. There is Q&A in the bottom, and then I will throw it to you, Brian.
All right. So this is by Jennifer Brown. Jennifer, what about mobile practices? How does it work? As it's hard to collect money in the home as staff are not doing that. Our staff's not doing that. Okay. So I have a whole program just on mobile PT practices. When you say collecting money in the home, are you referring to co-pays, co-insurances, and deductibles? I'm assuming. If it's cash-based services, you should try to get them on ACH and get them to pay, for a book of business before you even go out. So you should be paid before you go out if it's a cash-based arrangement. If it's an insurance-based arrangement, you're going to do it the same way you always do it. It's just that in the home, you don't have like a front desk and somebody doing that for you. So you can go one of two ways. You can either have your therapist carry a Square or something that they can just swipe cards and take copays and deductibles and stuff. I don't recommend that at all. I would say if I did a mobile PT practice, I would totally get a virtual front desk attendant who contacts the patient and handles all the processing of payment. So it all goes into one central hub. There's two things I never put in my therapist's hands, ever, ever, ever. I never let them touch the schedule. My therapist never scheduled their own patients. I have a centralized person running the schedule. And this is an outpatient setting. Mobile PTs, you kind of do schedule your own people, but I don't have my therapist handle the schedule, and I definitely don't let them touch the money. They're bad at both. They're terrible at both. So So I prefer to have it go to a central person who's fully accountable for the schedule and the money. So that's my answer to that. Does a live person also sit at front in a virtual front desk? No, or yes. It can go either way. Most of our clients, it's no, they don't have anybody. Everybody's gone. They went home. Payroll's zero in that area. We roll in the rack system. It's all loaded. There it goes. And we handle everything start to finish. It's totally good. Some people are like, no, I have this really great gal. She's just overrun, can't keep up on this, that. So then we come in and we'll do all the insurance verification. So we do that remotely, and she's the face of the company, sits at the front and just does patient registration. Or it's so busy, she'll just do part of that patient registration, and then we'll come in and we'll supplement. So it's scalable. You can have full service, you can have part patient registration, or you can have just insurance verification authorization support. How does virtual front desk interact with patients at the front desk phone? Oh, it's a big screen like Zoom. It's live and interactive. Many people are worried that the patients aren't going to like it. It's impersonal. No one's there. That is so not true. Look, Mike's standing, I'm sitting, we're talking, we're live. We're just like if we were sitting in the same room. Everybody today is accustomed to Zoom and remote live video interaction. It's video based. It's a live stream. So it's recording everything that's going on, everything that's said. It's fully secure, fully safe. The software company we worked with, we really worked together to develop it to a very good optimization. I tell people all the time, it's way better than you expect. Our pilot people came in, and within 4 months of working the virtual front desk, they hit their highest ever numbers ever, because it's just so consistent and just such a higher caliber of service. So if that's of any testimony for you, I mean, our 2 beta testers hit highest evers, not to mention all the other clients we already have now.
COVID certainly accelerated that, right? Everyone's used to being on these things.
It definitely upped people's comfort level with remote technology for sure. And, and I don't want anyone to walk away from this webinar like this is all about Meg and all about us. What this is about is what else are you going to do? That's the question you have to ask yourself. Are you just going to hustle and see more patients per hour and hope things work out? Are you going to try to just coerce your therapist into, coding more units per visit and hope that it makes up the lost revenue? I mean, you're doing a smart thing by getting prompt because you have the advanced technology to leverage for greater efficiency and reduce time and payroll. Good. If you believe that, then think about how it would be if you did it on the personnel side and the technology side and married those two together. You're going to have optimum benefit for your practice. You're going to be optimizing your clinical efficiency on the administrative side. Imagine a time when you go to a PT office and all that's in there is DPTs, PTAs, and techs. That's it. Everybody else is gone because everything else is being handled without your payroll doing it. That to me is how it should work.
Got 2 more questions.
How is paying for a virtual front desk? It is a prorated per FTE. If you go full service, it's prorated per FTE. If you go insurance verification, it's per claim. So we can go, we have it, we had to do a year of piloting to figure out what's the most fair and balanced way to pay for this. What is an acceptable rate? What is it going to allow us to actually cover the overhead costs and training of doing the service? We have found that we are in some places, we actually perform the services less than what it costs them to do in-house. I know it's hard to believe, but we actually can. And at worst case scenario, we might be 15, 18% higher than if they went in-house, but the level of work and the increased reimbursement more than makes up for that. I mean, we're well beyond that. We make that money back in our services. How does a virtual front desk assist elderly people, not my vision, non-tech Medicare patients, especially when they don't fill out their forms? No problem. The Medicare patients come in, they're not very tech savvy. All the forms are there in the rack. The person's on the screen walking them through it. Grab this form, show it to me. Yep, that's the right one. Go ahead, have a seat. The clipboard's right there, fill it out. It's no different than if the person's sitting at the desk. No different. They don't need to be there at all. Every piece of paper that you need them to fill out is sitting right there. It's well labeled. They do it every morning. Your staff that comes in to treat patients just double checks the rack, make sure it's fully loaded with all the documents, and you're set.
And then Brian, your email is just Brian@megbusiness, right?
Yeah, Brian, BRIAN @megbusiness.com. You can reach out to my assistant, Rachel, RACHEL @megbusiness.com, or Jen, JENN @megbusiness. I have two assistants, and they'll get you on the schedule with me. We'll talk about it. I can get you with Nicole, who's overseeing virtual front desk. Honestly, guys, there's no pressure here. We're not trying to sell you anything. We're trying to educate. With knowledge makes better decisions. Better decisions have better outcomes. So get with us, take advantage of our time and our expertise, ask all the questions you want about your unique situation, and walk away with that information and make an informed decision.
Well, thank you for hopping on today, Brian. I learned a little bit on this too. And
Awesome.
yeah, look forward to seeing you soon.
Thank you, Mike. And I thank you and Tim and your team for having me. I'm very grateful that you chose me to be here today. So thank you. And thank you for everybody listening. If there's anything more we can do to help you, just let me know.
Thanks, guys. Have a great day, everyone.
Bye, everybody.